with another important video. Okay, once a person gets a psychiatric disorder, he may has to compromise with all the roles and responsibilities. Say, for example, he had a very good occupation or vocation. So once he gets a psychiatric problem or any kind of a disability, the organization which had employed him, okay, may not be able to give him a chance to continue his occupation, or the client himself may not be fit, or he may lose his confidence to go back and work again. So in certain situations, when there are clients with the developmental disabilities or any kind of neurological problems, psychological disabilities, physical disabilities that they may develop during their lifetime, okay, so they may end up with compromising with the occupation. So such kind of the clients will be given a therapy which is going to enhance their skills and abilities, and they will be given an opportunity to practice their skills and abilities by placing them in certain occupational settings. So that kind of a therapy that we give as a rehabilitative services, we can say, is the occupational therapy. So today I'm going to talk about the occupational therapy. Occupational therapy can be described as the art and science of challenging the individual effort in specific selected activities that have been designed to restore and enhance the performance of an individual, right? So it is nothing but we have planned activities or planned occupations which are going to restore the abilities of the client to perform well, and also it is going to enhance the abilities of a client. Okay, when we teach them, you give some training related to the particular occupation or the skills. Occupation therapy involves any kind of the activity which engages the person's resources of time and energy, and it is composed of certain skills and values. Okay, so this is the occupation therapy which involves any kind of the activity which is going to enhance the skills and values of a person. Moving on to the definition of occupation therapy. Occupation therapy is the application of goal oriented and purposeful activity in the assessment and treatment of individuals with the psychological, physical, as well as the developmental disabilities. So, occupation therapy, if you take, we have got a goal, we have got a purpose which will help these clients with the psychological disabilities, physical disabilities, as well as the development disabilities to engage themselves in certain activities which is going to uplift the value of the person. Moving to the goals of occupation therapy, what are the goals? Number one, it helps in the promotion of recovery. So, what is this promotion of recovery? Say, for example, the person that underwent a disorder, depression. So, he would be in such a position that once he even gets the recovery, he may not be able to go back to the workplace, face the situation, work, and take the responsibilities. So, occupation therapy is going to help the client, such clients, to completely get recovered from the particular disorder. So, it will help in the promotion of the recovery. The second goal is mobilization of assets of the client. So, it can be asset. Okay, when I say the asset of the client is the overall well-being or the potential of the client or the ability of the client. Okay, occupation therapy is going to help to improve the overall potential and well-being of the client when we plan the activities, when we give the training in certain skills. Okay, the client will completely be able to give the highest potential from his side. Third goal is prevention of hospitalization. Okay, there are conditions wherein, okay, completely they have to be hospitalized, or for a longer duration of time they have to be hospitalized. So if they have given or training in certain skills, okay, they may not be in a position that, completely they have to be staying in a psychiatric hospital in terms of being hospitalized. No, they can work independently. So occupation therapy is going to prevent the hospitalization. It's going to give a chance for the client to engage himself in certain activities, in certain occupation, which is going to again improve the client's economic condition also. The fourth goal of occupation therapy is creation of good habits of work as well as leisure. So, what are these good habits of work and leisure? How they have to interact themselves, how they have to be in a working position. Okay, so when they are into a particular job, okay, how the work environment they have to adjust, how they have to be in a workplace. So, that will be taught by the recreation therapy. Now, to use the leisure time. So, whatever the leisure time the client gets, how economically he can, how constructively that he can use his leisure time, so that will be taught via the occupational therapy. The next goal is to enhance the client's self confidence. So how low the client would have gone when he had lost all his roles and responsibilities. He may go down. Okay, he may feel very inferior, he may lose the confidence, he may lose his self-esteem. Okay, so in such conditions, when we train the clients, when we teach them the skills and we place them in various settings, it's going to improve the self-esteem, it's going to boost the confidence of the client. Moving on to the setting, okay, in which all settings the occupation therapy can be given, the services can be delivered. Okay, mainly occupation therapy is given to the age group of children, adolescent, elderly, as well as the old age group. If you take the settings where all the client can opt these services, number one, they can get the services in a psychiatric hospital. So, if you take a psychiatric hospital, we have got the various departments wherein the rehabilitative services or the occupation therapy will be taught to such clients in the psychiatric hospital. Next one is in the nursing homes, psychiatric nursing homes, in the rehabilitation centers, in certain special schools. Okay, if the child is having a developmental disability, so such children will be sent to the special school wherein they'll be learning the various skills. It can be daily living skills, the educational skills, or whatever it is. Okay, so all those things will be taught to the client in the special schools. It can be delivered in the community mental health centers. So if you take the community mental health centers, even there, okay, there will be sessions wherein the clients who have the problems with the developmental disability, physical disabilities, or the mental disabilities, they can attend these community health centers. They'll be given training and the placement. The next setting is the halfway homes as well as the de-addiction center. So if you take the de-addiction center again, we get number of clients who are having this problem with the substance abuse. Okay, so it's very difficult for the such clients to go back to the society, because the society is having a lot of stigma and a lot of negative conception about such people who are into any kind of a drug abuse or substance abuse. They will not accept such clients very easily, or without thinking a second thought. So such clients will be given training in the de-addiction centers as well as in the halfway homes, and they will be placed in the various departments for the occupation. Moving on to the services which will be provided by the occupational therapy. So the first important service is teaching the clients the independent self-care. Okay, self-care skills or daily activities will be taught so that the client independently can carry out his daily activities, right? We have got many patients with the neurodevelopmental disorders, say for example cerebral palsy or any kind of a developmental disorders, chromosomal disorders, mental retardation, so many disorders that we have, disabilities the clients are having. Okay, so they don't even know to practice independently the self-care needs. They are not able to meet. So such clients will be taught how to carry out their own needs or how to have the self-care. Okay, such skills will be taught to the clients. Other services like crafts, socialization process, how to use the leisure time, and the education services for the child as well as adolescent, employment and academic preparations. And for the ladies or for the women, okay, they will be teaching how to take care of the home, that is homemaking, how to take care of the children, child care, as well as parenting. So all such skills will be taught, or the services which will be provided in the occupation therapy. The next service is designing fabrication and how to apply the orthotic devices. So this is also one of these services. Apart from this, the clients will be taught certain exercises which is going to help the client as a treatment. Okay, therapeutic exercises will be taught to the client. And the last service that the patient will be given the counseling, education, okay, in terms of individual education, the family education, counseling will be given to the clients. Okay, so these are certain services that the client can get from attending the occupational therapy sessions. Moving on to the activities in the occupational therapy. What are the various activities which can be given and planned, right? So if you take the inpatient department, if there is a client in the inpatient department in the psychiatric hospitals, what kind of activities as an occupation therapy can be planned for the client? Okay, number one is the assertiveness training. So what is this assertiveness training? Here the client will be taught the skills how to talk for himself, how to take the roles and responsibilities of not only himself but also others, how to say yes and no, how to be in a social group, how to interact, and how to fight for the rights of their own self as well as the others. So that is what is assertiveness training that will be given. The next thing which will be taught is the activities of daily living. So from the time the client starts his day, what are all the various activities that he may has to face, and how he independently has to take care about his own self. So such skills will be taught in the daily activities. So various other activities like the music, art, craft, clay work, all these will be taught. Poetry, the drama, craft work, woodwork, weaving, painting, social skill training, industrial works, sieving, leather work, ceramics, the pottery. So these are the various activities that we can plan for a client in the occupational therapy sessions. Okay, so based on the interest of the client, based on the abilities of the client, so we will identify, we'll be doing the assessment, then we will be placing the clients in these various settings. It can be related to leatherwork, carpentry, or crafts, or painting, or anything. Okay, based on the interest of the client, they will be put in a particular department, they will be giving the training, they will be learning the new skills, and they will carry out it as an occupation. Okay, for which they will be paid some kind of the remuneration or the amount. Okay, so these are the various activities for a client who is there in the inpatient department. Even for a client who is on the outpatient basis. Okay, so we have got the rehabilitative centers wherein from morning till evening they can come. Okay, do the whatever work or responsibilities or activities is assigned to them based on their abilities and their disabilities. Okay, so they'll be placed, they'll be given the training from morning till evening. They will stay as a daycare. Okay, they will stay in the particular department, do all the particular responsibilities, they finish their activities, and the evening they will go back. Okay, so for that they will be given some economy or some fixed salaries that they will be giving, so that they can use it for their living. Okay, so that kind of a service is also is there in the rehabilitative centers. Moving on to the classification of the occupation therapy. If you take the types of the occupation therapy, mainly we have got the two types. One is the diversional type of the occupation therapy. Second one is the remedial type of the occupation therapy. The first one, the diversional type of the occupation therapy, as the name says, we are going to divert the client's thoughts and feelings, to some kind of activity. So for that purpose, when we plan, it is called as diversional occupation therapy. For example, you plan certain organized games so that the client will divert from the thoughts. Say, for example, if there is a patient with schizophrenia, okay, he may have thoughts of delusions, hallucinations. To divert the client from that thought, we will be involving the clients in certain games. Okay, that is called as diversional occupation therapy. The next one is a remedial occupation therapy, otherwise it is called as therapeutic occupational therapy. So here, as a therapy or as a care, you're going to give the treatment. Okay, so that is called as the remedial occupation therapy. It mainly involves the physiotherapy for various groups of muscles. Okay, in terms of the physiotherapy, when you teach certain activities like basket making, weaving, okay, or carpentry, gardening, embroidery, and other types of the physiotherapy activities like exercises, heat massages, use of various electrophysiological equipments. Okay, so all these as a therapy or as a treatment process, you are making the client to undergo a occupation therapy. It is called as remedial or the therapeutic occupational therapy. Moving on to the occupation therapy process. So if you take the occupation therapy, how is the work going on? How is the cycle of the occupation therapy? Mainly, it includes the three steps. One is the assessment, second one is the treatment, third one is evaluation. Right? So these are the three main steps involved in the occupation therapy process. So if you take the assessment again, it's been divided into certain steps. So one is the initial assessment. So in the initial assessment, what is done is you're going to interact with the client. You're going to do the assessment of the client. You're going to find out what are his difficulties, what are his abilities, what are his disabilities, what are his limitations or weakness or strengths. So that is the initial assessment that you're going to do. The second one is a detailed assessment. Again, in depth, you're going to find out about, okay, these are all his problems. So why he ended up with this kind of a problem? What are the interests of the clients? Okay, so what are the difficulties that he is facing? So all those in detailed assessment that you're going to do. That is the first step of the assessment. The second step, if you take the treatment, you've got the treatment plan. So what is this treatment plan? Here, based on the assessment, whatever you have done, you're going to plan the treatment. You're going to set the goals, okay, or the objective. So goals which can be attained. Okay, short-term goals, it can be or long-term goals, which can be attained. Okay, so such kind of a goal setting that you're going to do, and you're going to plan the treatment. You're going to plan what kind of the activities that the client can actually carry out. Okay, so based on the assessment, you're going to set a goal and you're going to plan the various activities for the client based on the interests and abilities of the client. The next thing you're going to do is the implementation of the treatment or implementation of the plan. Okay, say for example, you've planned that the client is, having the ability to do the basket making. Okay, so you have planned, you're going to implement the treatment. You're going to put the client in the particular setup. You're going to give him the training. You're going to teach him the skill of basket making, and you're going to be with the client and supervise and observe the clients how well the client is able to do. Okay, so implementation of the plan is done. The next step is the treatment review. So what is the treatment review? Whatever the client has implemented, he has performed his task, you're going to review his treatment, whether this treatment is effectively done, or what the skill the client has exhibited, whether it is completely that he is able to put in his efforts and skills, is able to perform it well. Is there any kind of a difficulty for the client? Okay, so what is the treatment that you have given to the client? You're going to review the treatment, whether it is done or not done. Okay, so then you're going to do the final review of the complete assessment of the implementation what the client has done, and based on that you're going to evaluate the client whether this particular task is being done effectively, whether he can carry out the same, or whether he needs any kind of a alteration or improvement for the betterment of the client, or whether he is not able to carry out this activity or this skill, whether he requires the treatment, another treatment option, alternative, or a new skill that he can carry out. Okay, so that you can evaluate and you can replan the treatment. Okay, so this is the whole cycle of the occupational therapy. So you're doing the assessment, you are doing the treatment, and you are evaluating the treatment. Okay, so this is about the occupation therapy process. Moving on to the advantages of the occupation therapy. What are the advantages? Occupation therapy is going to build a more healthy and integrated ego. Okay, so you know how the ego of the person is. Okay, he may end up with ending a poor ego, but when he start the skill, or when he start certain occupation, okay, so it is going to improve his ego. He's going to have an ego integrity, and the health of the client can be improved. Occupation therapy helps to express and deal with the needs and feelings of the client. So, through the occupation therapy, the client will be able to express all his needs and all his feelings. The third advantage is it's going to assist the client to meet his basic needs, or the daily living can be learnt by the client independently. He can practice without the help of the second person. Through occupation therapy, he will learn the daily skills, or the basic needs can be met independently. The next thing is it's going to strengthen the ego defenses. Okay, so here the client is going to improve his ego integrity again. The next advantage is it's going to reverse the psychopathology. So what is this reversing psychopathology? He had a developmental delay, or he had a developmental disability, or a psychological disability, physical disability, whatever the psychopathology was. It's going to help him to reverse the psychopathology, to come back to the state of the normalcy. The next advantage is it's going to facilitate the personality development. The overall growth of the personality, overall development of the personality can happen through the occupational therapy training. The next advantage is it's going to help the client to develop the self-esteem as well as a good self-concept. So when he is able to attend everything independently, when he is able to carry out some task and perform well, okay, so it is going to help the client to develop the self-concept, and also it is going to boost the self-esteem of the. So these are about the various advantages of the occupation. Moving on to the suggested occupational activities for various psychiatric disorders, right? So you got various psychiatric disorders. So what kind of occupation therapy you can plan? Okay, that is what I'm going to talk about now. For a client who is suffering from the anxiety disorders, what kind of occupation therapy that you can plan? You can plan for simple concrete tasks, which is having about not more than 3 to 4 steps. Okay, for example, like sweeping, washing, weeding the garden, right? So all these activities or the occupation, it is not going to give lot of steps to the client, which is going to increase the anxiety of the client or stress level of the client. No, simple activities or a task which is having a minimum of 3 to 4 steps which he can carry out. Okay, such kind of activity we can plan for a client with the anxiety disorders. Next, for the client with the depressive disorders, Again, you can plan for simple concrete tasks which can be achieved by the clients. Like you can involve the client in the craft work, okay, in the painting. So such kind of the activities you can give which are non-competitive. Since the patient is already depressed, if you give any kind of activities which are competitive, the client may not be able to complete the task. So again, he may go down, okay, or again he may feel the depressed mood. So you are not going to give him the complex task, you're going to give him simple concrete task which he can achieve. The next disorder is for manic disorder. So for manic disorder, you understand the clients will always be very much exaggerated. Okay, they have lot of energy and enthusiasm, right? So such kind of activity that you will plan for manic disorders which are non-competitive, but it should allow the use of the energy that he is having and also express his feelings. Such kind of the activity you will plan for the clients with manic disorders. For example, ranking the grass. Okay, so it requires lot of energy to do, and he will feel exhausted and he feels better when he does that. Next is for the schizophrenia. So for schizophrenic conditions, you will be giving non-competitive solitary kind of the activities which involves more use of concentration and attention, okay, individualized activities that you will plan. Say for example, for paranoid schizo, you will be giving the puzzles. For catatonic type of schizophrenia, you will be involving the clients in clay molding. Okay, so such kind of activities you can plan. The next activity is for antisocial personality. If you take an antisocial kind of a personality, you know they will be very aggressive. They will be always against the society, try to, sorry, they want to harm the society. Okay, such kind of a personality, what kind of a occupation that you will plan? You're going to such kind of activity that you will plan, which is going to enhance the self-esteem and expressive and creative activities that you're going to plan. For example, working with a leather, okay, painting, wherein the client can express all his antisocial thoughts in the form of painting or creativity. So that way, it can channelize all his energy. You will also involve the clients in group activities, which is going to improve the feeling of belongingness as well as self-worth. So you know such a client with antisocial personality will not be accepted by the group. Okay, they will try to isolate such patients. But you're going to plan activities wherein you're going to make the person to involve in the group and develop such kind of feeling of self-worth and belonging. Okay, you involve the client in cover making activity, packing the various goods. So the next disorder that we have is a substance abuse. For such kind of a clients, what is the activity that you are planning? You're going to plan for group activities where he's going to exhibit all his talents. For example, you involve the client himself to plan the various social activities. So you involve the client in planning the activities itself. Okay, that itself is going to help him to exhibit his talents in the planning. Moving on to the children and adolescent disorders. So, for the children as well as adolescents, what kind of activities you can plan? For children, you can involve the child in playing, storytelling, painting, drawing, poetry, as well as involve in various music. Okay, so that kind of activity you can plan for the children. If you take the adolescent group, you can involve the adolescent in the leather work, in painting, as well as even in the drawing. If you take the child with the mental retardation, based on the level of the mental retardation, you're going to plan the activities like cover making, candle making. So these are about the suggested activities in various psychiatric disorders. Moving on to certain important points that you have to keep in mind when you plan the occupational therapy for the client. Number one, you're going to involve the patients in the selection of the activity. So yes, it's your responsibility to plan for the activity, but you have to involve even the client to select what kind of the activity that he would like to perform. Okay, so what is his interest, which is going to again boost his motivation and his self-esteem. Next is Whatever activity you plan for the client, you see to it that the client is able to use all his strength and abilities for the particular activity. It shouldn't be very much limited for the client, that some kind of a restriction for the client to carry out. No, it should be freely able to exhibit all his talents, use all his strengths and abilities to carry out the particular activity. Whatever the activity you plan, it should be of a short duration. Okay, it shouldn't be like the client is not able to achieve the task. No, the particular activity should be planned for a short duration of the time, and also such activity should foster a sense of accomplishment. The client should feel satisfied of completing or successfully completing the particular task or a activity. So you should plan the activity for a short duration of the time which the client is able to achieve. The next important thing is you have to select the activity such that it should bring a new experience for the client. Okay, now, always you plan the same activities every day, you give the same activities to the client feels very bored about it and they lose the interest. No, every time you plan the activity, you see to it as much as possible that it is not monotonous. You give new activities so that the client will experience new in his journey, and if it is possible, let him continue. If he is not able to carry out, give him the ability or a chance to change the particular activity. So he will also understand. He may not know what skill that he is having, what talent he is having. Maybe he is good at it, but first time when he goes, okay, only then he comes to know that he is very good at the particular skill, right? So it should be such that the activity should not be monotonous. He should learn a new experience out of the activity. Moving on to the nurse's responsibilities. What is the role of a nurse in the occupation therapy? Number one, she's going to be the observer. So what is the observer here? She's going to frequently monitor the client, okay, as to his behavior. What are the changes in the behavior? Is it helping him out in modifying his behavior, or is he learning a new behavior? Is he learning to adapt to the different situation? So you're going to do the assessment. You're going to observe the client. You're going to monitor the client's behavior. Next role is being a teacher, right? So as a teacher, you're going to educate the client about the various activities. Okay, what are those things, how he has to perform, how he has to develop the skills. So you're going to teach him to develop the particular skills, or how he has to work with the particular task. The next role is being a parent. Okay, so being a parent, you have to see to it that the client is not only performing well in his activities, all his basic needs are also met. Okay, so that is the responsibility of a parent, being a caretaker. You have to take care of the client's needs, see to it that basic needs are met, okay, of the clients. The next role is being a supporter. Always encourage, motivate the client so that he develops the feeling of self-worth and confidence. The next role is being a guide and a friend. So always you have to see to it that you counsel the client, guide the client in the particular task, whatever he is doing. Be friendly with the client so that he will be able to take things from you, in a comfortable way, so that he develops the trust, and it will help in the treatment process. Okay, so being a guide and a friend is very important. The next role is being a warden. So being a warden, you have to be there to take care of the client's environment, to take care of all the needs of the client. Okay, so these are the various roles or the responsibility of the nurse in the occupation therapy. So overall, if you take the occupation therapy, it is going to help the client to restore or enhance his abilities, to develop his abilities and skills, and place them according to their skills and abilities in various settings so that they can carry out their living, in a better way. So it is going to improve the client's self-confidence and self-worth, which is going to make the client to lead his life in an independent way. Hope you all have understood the topic.